We're spending some time with Dr. Joseph Varley, a board-certified psychiatrist with Summa Health Behavioral Health Institute, also the chairman of the Summa Health Department of Psychiatry. Doctor, thanks so much for spending some time with us.
Thanks for having me.
We are talking about mental illness and addiction recovery tailored to the needs of the patient here at Summa Health.
Yes. Well, that's how it should always be, is individualized. Even as a psychiatrist, I take some issue with the idea of mental illness. I think we all know kind of what it means, but I really prefer to use mental health. And that life is difficult, and people struggle in all kinds of ways that are related to living. And so what we're trying to do, and especially with this level of care, is provide people an opportunity where they can have support and help in managing the challenges and struggles of living, and that's always best treated in an individualized way. Here at Summa, our intensive outpatient programs are in different locations throughout the community. We have addiction and mental health IOPs based here at our main campus at Akron City. In Barberton, we have an intensive outpatient program for addiction. And in Hudson, we have programs for mental health and addiction. So we try to meet people in a way where they can more comfortably get to the services.
Here at Summa Health, you have intensive outpatient programs available. What's that about?
Well, it's a level of care that is sort of between having to be in the hospital 24 hours a day, hospitalized
Right.
in the hospital. And that's one extreme of the intensity of treatment. More traditional outpatient treatment where maybe you'd come and see a therapist or a clinician once a week or once every other week. Sometimes that's not enough. Sometimes the hospital is way too much.
Right.
So the intensive outpatient programs are designed to meet the needs of providing a substantial amount of care while people maintain their independence, autonomy. We have programs in the evening so people can work and attend school. So it's not disruptive to their life, but it provides them with a level of support that they need and deserve during some turbulent time that they're going through.
The intensive outpatient program, or IOP, does that involve family members as well?
Sure, it can. The intention is for that always to be part of the program because often these situations, circumstances, family can be very supportive and helpful, and for them also to be informed about how to engage and help their loved one who's struggling. So it's an important part of the program.
I can only imagine how perfect this is to actually make it fit for every individual patient.
We do our best.
Yeah, no doubt. I mean, considering the schedule that we all have, you know, life does not stop.
No.
And when you are hospitalized, life stops.
Yeah.
Yeah, and with this program, it does open up a lot of opportunities, and I'm sure it attracts more people to say, you know what, that could work for me.
Yes, it's a much more favorable alignment of meeting somebody where they're at and not disrupting their life, but giving them the opportunity for support that they need.
They can maintain a work schedule, a school schedule, and still undergo treatment. It's a perfect fit. If you want to get more information, it's as simple as going online to summahealth.org/IOP. Or you can call Summa Health at 330-379-9841. Thank you, Doctor.
Thank you.
This segment of Good Company was sponsored by Summa Health.